Well, I was just going to ask if you would, let's start to bore down into that structure. I mean, when we say it's
Yes.
structural, what do we mean by that?
Well, let me just, so when I uh, show a map of Chicago, for example, and show the life expectancy is of being under 69 in this one neighborhood, and I give another stat that a 16-year-old young African American man has a little greater than a 50% chance of living to the age of 65, and I ask, what's the cause of death? People always say gun violence, which is a problem. I don't want to minimize that. But the number one and two cause of death are heart disease and cancer. These are diseases for which treatment, early detection can make a difference. But the burden of disease in these neighborhoods is conditioned by, I would say, two big driving factors. One is poverty and the inability to create wealth, and then sort of the lack of educational opportunities. And if you look at these neighborhoods all across America, the people in these neighborhoods are stuck in place. Have trouble leaving. And it's not what I call the three Bs, beliefs, behaviors, and biology, even though those contribute to health themselves. It's the neighborhoods themselves. And when you concentrate poverty in neighborhoods, when that concentration gets up above 20% or so, it impacts the health of everyone, not only in that neighborhood, but in the surrounding neighborhoods as well. These neighborhoods tend to be surrounded by neighborhoods that are like them. So likely you're coming into contact with other very distressed people in your day-to-day world. And it's structural in a sense is a form of, I call it structural violence. It's not my term, but it's structural because it's built into our laws, our procedures, the way we police, our funding for schools, our funding for youth programs, even our funding for health care. And it's violent because people die as a result. So it's different than gun violence. It's different than, interpersonal violence, but it's a form of violence that kills people nonetheless. It manifests itself as diseases, diabetes, heart disease, and premature mortality. And the premature mortality in particular strikes men. There are many of these neighborhoods just don't have middle-aged men and men who are into their 60s, where is the time in your life where you create wealth. So you get this vicious cycle of concentration of poverty, policies and procedures that have driven housing policy, policing policy, schools, disease, people dying off, and the inability to create wealth. The underlying structural causes to me are structural racism and exploitation, economic exploitation. And there's a solution is to bring, better jobs and education back into these neighborhoods. Health and healthcare is important. The built environment and violence and food access is very important. But a lot of this is the underpinnings of this are economic and educational.
How much let's talk about the failure of, I guess, the medical profession to recognize this dynamic, right? I mean, I think at one point you suggest that, that like naming a cause of death as the final, I guess, death blow is problematic because, and I guess I'm paraphrasing, and if I'm getting this wrong, correct me, please. But it obscures the aggregate of factors that have led to that last moment.
Exactly. And so I've been giving this explanation because I spent many years as a chief medical officer at Rush University Medical Center. And in the death gap, I talk about getting to the right root cause. So when something happens in a hospital and a patient is harmed, it's really important to get the root cause right because so you can fix it. And the same goes for the causes of death in our neighborhoods. If we don't name the root causes correctly, how can we possibly get to solutions? So if we believe the root cause of this is biology, or just behaviors or people's beliefs, and that's driving the mortality gap, then the fix is to fix the individual. But if we really believe, which I believe, that is structural racism, historical injustices that are getting perpetuated into the present, that is structural in the fact that schools are not doing their service to children, that there are not jobs that are available that can create wealth. I'll give you an example. If you look at this same neighborhood in Chicago where life expectancy is under 69, the most common job is low-wage healthcare jobs. The most common location is out of the city of Chicago. So people don't go, they have to get a job, they're low-paying, and they're outside of the city. And people are stuck in this vicious cycle, and it causes stress, and that stress gets embodied, and it gets embodied as illness, and the illnesses occur prematurely. There's something called biological weathering, where the actual tips of the genes get shorter. The telomeres of the genes, the growing tips of the genes, get shorter when people are subjected to the stress in these neighborhoods. So that's kind of getting to the root cause, is getting to, the structures that perpetuate historical injustice like racism. And wealth inequality is a giant piece of this in this country and across the world. So if you look at health gaps, life expectancy gaps, in general, life expectancy has been rising for everyone. But in the United States, the lowest 20% and wealth and lowest 20% income earners in the country have actually seen their life expectancy drop. And whereas the highest income earners have seen their life expectancy rise, leading to a growing gap between the rich and the poor based on who lives and who dies. And while we can all say that, wealth gaps are something, of a fact, people should not die as a result. And in countries like Canada and Britain, there's not such a gap between the poor and the rich and who lives and who dies, largely because there's more of a social safety net that's wrapped around people from the time they were born, unlike the United States.
All right, let me just make sure I understand that last part. You can find income or wealth gaps that are analogous to what we have in the United States. However, we have a disproportionate death gap, essentially, that accompanies that in the United States. Is that it?
So let me be very clear. The United States has among the highest wealth gap of all the developed nations. We're worse than everyone else. But on top of that, this is why I in the death gap, the subtitle is How Inequality Kills. On top of that, because we don't have universality of health care from the day you're born in this country, the poor, and for other reasons that have to do with public policy, the lowest 20% in this country in terms of life expectancy, we've seen that drop since 1980, whereas the highest 20% in income have actually gotten better. And that gap is not seen in Canada or Great Britain to the same degree. They have a gap, but not to the same degree. The United States is a worse of all the developed countries. For example, child poverty in the United States ranks 34th out of 35 developed countries between Bulgaria and Romania. And so these things, so when you're stressed when you're young and we don't help you out, that accumulates and becomes illness and premature adult mortality.